Today's presenter is Dr. Victoria Leiphart. Dr. Leiphart received her medical degree from the University of Virginia School of Medicine. She completed her residency at New York Hospital Cornell Medical Center. She is board certified in obstetrics and gynecology. Dr. Leiphart has been in practice in the Bay Area since 1989 and in Fremont since 1992. She is also a member of the Washington Township Medical Foundation.
Good evening. Welcome, everyone. My talk is going to be on probably the most neglected aspect of caregiving, which is taking care of yourself as a caregiver. The first thing I want to do is give you all credit for recognizing that you're a caregiver. What I see in my practice is that most of my patients who are caregivers don't give themselves that title. They think of themselves as the spouse, the adult child, the best friend, and they don't label themselves as a caregiver, and therefore they don't Google caregiver and know all the resources that are out there for you as a caregiver. We'll be talking about the resources that are available to you over the next few weeks, but for the next 20 or 30 minutes, I want to talk about providing good care to yourself, because, you know, as the airlines say, put your own oxygen mask on first. You really are a better caregiver if you take better care of yourself. The data's pretty clear that there's some pretty significant health consequences to being a caregiver. Of people who are full or part-time caregivers, they describe the physical strain of caregiving as being severe 14% of the time, and emotional strain as being severe almost a third of the time. And caregivers describe their own personal health as poor about a fourth of the time. 3/4 of caregivers have delayed medical care and put off doctor's appointments because of their family obligations, work obligations, and 2/3 say that their diet is worse, that their health is worse as a result of being a caregiver. The rate of depression, and this is not just having depressed feelings or occasionally having a depressed mood, this is people who meet the diagnostic clinical criteria for full-blown major depression. Half of caregivers, half. In some studies, more than half. It's really a pretty amazing statistic. And it can even result in fatal disease of spouses caring for a spouse. If you're between the age of 66 and 96 and you're caring for a spouse, you're the primary caregiver, your death rate is 63% higher than similarly matched controls who are not caregivers. And some studies estimate that if you're a full-time caregiver in a particularly stressful situation, you can lose up to 10 years of your lifespan. So this is, you know, people just put off their own health needs and they think, well, you know, it's more important that I take care of my family member who's ill, who has Alzheimer's, who has cancer, who has whatever. And you put off your own health care and take care of them, but in fact your own health care suffers pretty dramatically. And you're more tired, you're more irritable, you're not as good or as patient a caregiver if you take bad care of yourself. So I want to talk just briefly today about some of the things that you can do, that you can actually fit into your schedule to be a better caregiver. The amount of exercise that the CDC, the Center for Disease Control, recommends for adults are 150 minutes a week of moderate exercise, like walking, biking, or swimming. That's 2.5 hours, so half an hour, 5 days a week. Or if you do more strenuous exercise like running, hiking, you can do half that amount of exercise plus 2 days of strength training. Now, for most of my patients who are caregivers, this is so far beyond what they're going to be able to fit into their day. You know, most of them My younger patients that are caregivers are still working full-time, plus caring for a spouse or a family member or a friend. My older patients have other obligations. This is such an intimidating number for most of my patients. So I want to encourage you to start smaller, think smaller, because not enough time is the constant complaint for my patients who have these obligations. Start with 10 minutes. Everybody has 10 minutes. And if you walk out of your door for 5 minutes, turn around and walk back, you've gotten 10 minutes of exercise. And if you do that 3 times a day, you've met your 30 minutes for, the CDC guidelines. And even a little bit of exercise makes a difference. Even 10 minutes a day makes a difference. In fact, there was a big study that showed a 40% reduction in death from heart disease with an hour of exercise a week. 1 hour a week. That's 10 minutes a day. And you would not think that that would make a difference. It does make a difference. And if you can go outside to exercise, you get a much greater reduction in stress hormones, blood pressure. You just feel better if you go outside and see a tree. It's just going to be a more pleasant environment for you to exercise, and it just gives you a break to go outside and see a little bit of nature. You don't even need much. Just a couple of trees will do you good. And so your mother was right. Go outside and play. Mothers are always right, right? My 20-year-old's starting to realize this. I want to talk just briefly about nutrition. Most of us are of an age where we grew up with a food pyramid with all the whole grains at the bottom, the, fruits and vegetables next, and then, the meat at the top and fats and sweets at the top. That has just been completely eliminated for the choose my plate. And what I really want to emphasize for everybody, half the plate is fruits and vegetables. And then some kind of whole grain, oats, brown rice, whole grain pasta, and then some kind of protein. Nuts, tofu, beans, lean meat. Dairy was controversial, actually, because a lot of people are lactose intolerant and can't tolerate dairy. It was controversial whether dairy even got on there. So my take on dairy is, if you like dairy products, have dairy products, and if you don't like them, don't worry about it. My favorite food writer is Michael Pollan, and this is what he says in his book, In Defense of Food. He said his message about food can be summarized in 7 words. Eat food, mostly plants, not too much. And by that, he means, when he says eat food, he means real food. Fruits and vegetables, whole grain things. If it has more than 5 ingredients, you probably don't want to eat it. If it has ingredients your grandmother wouldn't recognize as food, you probably shouldn't eat it. You can't read the small print on the corn muffin mix, but hydrogenated lard is one of the ingredients there. Hydrogenated anything you want to avoid, and hydrogenated lard is about as unhealthy a food as you could find. The farmer's market is your friend. Fruits and vegetables are what you should be eating, and you feel better if you eat better. And the person you're taking care of is gonna be healthier if they're eating more fruits and vegetables. You just feel better. If you eat junk, you feel terrible. Mostly plants. That's pretty self-explanatory, and there's a growing push to go toward a more plant-based diet. But if you have plants as the center of your diet, you're just going to be healthier. The more fruits and vegetables you eat, the better off you're going to be. And you don't have to radically restructure your diet. If you just add 1 extra fruit, 1 extra vegetable every single day, you'll just be a lot healthier. Not too much. That's kind of self-explanatory. Smaller portions, eating on smaller plates. The average American eats 70% more calories now than they did in the 1970s. It's a pretty amazing statistic. And a lot of that extra calories is simple sugar. And your food doesn't have to be miniature. Those are actually deviled quail eggs. But, but you do want smaller portions. And it's such a cute picture that I use that to talk about portions. Can you imagine peeling those? That was a real labor of love. You know, the person who peeled all those quail eggs did it for a baby shower. She said never again. The most important thing I want to talk about is stress management, because it is the toll that stress takes on your body that I see in my office. People are sleeping poorly, they have high blood pressure, they have stomach irritation, their body just aches all over. They are so stressed out by their family obligations, by their caregiving obligations, by their parenting obligations, by their work obligations. They're just overwhelmed. And I want to give you some really simple stuff that you can do, because it'd be great if we could all just take a month and go to India and meditate and, you know. But most of us are not going to do that, and we need small things we can do through the day, just like aiming for 10 minutes of exercise and a little extra fruits and vegetables. You really have to start small, especially when your obligations are just piled on top of you and you don't have time to, you know, even take a shower some days. I myself was one of the people who was a little skeptical about meditation. I've tried it off and on for years, but because of the research that I've done for the wellness class that I'm teaching here, I have become pretty impressed with the data. You know, I'm a science girl, and when people tell me, oh, you'll feel better, you'll feel more in touch with the universe, you know, that leaves me cold. But when somebody shows me the drop in blood pressure, the drop in heart rate, the reduction in anxiety, the reduction in chronic pain, the reduction in depression, and the structural changes in your brain that come with meditation, okay, I'm convinced by that data, you know. And I would encourage all of you to find 10 minutes out of your day to start meditating, even if it's something you've never done before, even if it's something that you think of as, oh, hippy dippy weird stuff. Just try 10 minutes a day for a month, and if you don't notice any difference, then fine, you've given it a try. Here are all the excuses. I've used every one of these excuses. No time, everybody has 10 minutes. And too hard, don't know how. The basic meditation is to sit in a comfortable chair or lie down for 10 minutes with your eyes closed and focus on your breath. Just breathe in, breathe out. You can focus on a word, you can say one, or you can focus on a word that's meaningful to you, like love or peace or balance. And just when your attention wanders, bring it back to the breath. 10 minutes. You can set a timer if you want. Can't focus or turn off my thoughts? This was always my excuse, because I always had the thought that I can't empty my mind. I can't keep my mind from wandering off. And really advanced meditators can really achieve a state where they are truly, their mind is empty. They really are at a completely quiet place in their mind. People who've done this for a long time really are able to do that. But for the rest of us, the whole purpose of meditation is to recognize that your mind has wandered and bring it back to the breath. Recognize that it's wandered and bring it back. And that may happen 100 times in 10 minutes. And I'm telling you, it happens less often the longer you practice, but it will happen. And recognizing that your mind has wandered and bringing it back is really the whole point. Can't sit still, you only have to sit for 10 minutes, and you should just be in a comfortable place where your body can sit for 10 minutes. As you get better at this and more comfortable, you can work your way up to 30 or 40 minutes, but I'm telling you, just start with 10. It's boring. Boring is kind of the point, really, because we're all online and looking at our phones and constantly stimulated by the barrage of information that we get from the TV, from the traffic, from work, from everything else. And it's very seldom that we have 10 minutes where we do nothing. And for most of us, doing nothing for 10 minutes is really difficult. We feel like we're gonna jump out of our skin, but I'm encouraging all of you to at least try. A lot of people think of meditation as a religious practice, and it is part of a traditional religious practice for a lot of faiths, for Hinduism, for Buddhism. Prayer is a form of meditation, but it is not by its definition a religious practice. It does not need to be a religious practice. But if having it as part of your religious faith makes it easier for you to meditate, use that as part of your faith. That was to remind me that you can't sit still. Mindfulness. This is a little bit difficult to describe exactly. It really is, it's a way of talking about living in the moment and being in the moment. For most of us, as we go about our day, we are constantly thinking about what just got done, what just got said, rethinking about a conversation that we had, or we're thinking about what needs to be done. I've got this on my to-do list. I have this errand to run. I have this discussion I need to have with a family member. We are constantly thinking about what we have to do and rehashing the past. And it's very rare that we're actually fully in the moment, that we are just looking around as we drive and noticing the trees, noticing the other cars, noticing the other drivers, that as we walk, we actually look around and see what's truly around us, that we're fully in the moment and feel our body in the moment. It's very rare that we're not a million miles ahead and that we're really actually focusing on what we're doing at the moment. And mindfulness not only is being present in the moment, but being present without judgment. So instead of saying, oh, I'm fat, I need to exercise, you're just present in your body without saying that your body is good or bad, that your thoughts are good or bad, that the way you're thinking about something is right or wrong. It's really just being in tune with where you are at the moment. It's kind of a nebulous concept, but I've given you guys a little information on some mindfulness practices. This one you guys actually have some ways that you can incorporate being more mindful into your day. Things like when you first wake up, don't just jump out of bed. Don't think about, oh, I've got to, make the coffee and get dressed and rush around. Take a few moments when you first awaken to just take a few breaths and just feel the effect of your body and the breath on your body. And instead of rushing about, give yourself a few extra minutes to have a little more Zen space in your morning, or a little more Zen space as you arrive to home. I tend to get home and immediately start dinner. And I'm immediately in that sort of frenetic mode, but I try to take a few minutes to just sit and take 5 minutes before I get into that I'm at home, have to do X, Y, or Z kind of mode. Sometimes you can use events in the day to trigger that reminder that you need to take a deep breath. So you can use the phone ringing. You can use, every time. I know somebody, every time she walks through a door, as she passes under the door jamb, she takes a couple moments for a couple of deep breaths. Find your own little things that work for you and incorporate them into your daily life. When I'm driving home, there's a certain part in my drive as I drive down Paseo Padre where Mission Peak comes into view for me. And I look up at Mission Peak every night, and I notice the palm trees along the street, and I just take kind of a calming breath, and I feel like I've made a more peaceful transition from work to home. I'd like to encourage all of you to take advantage of the classes that are here. There are yoga classes, Tai Chi classes, Zumba classes, because getting some exercise, getting out of the house, and taking time for yourself just makes you feel better. And starting this fall, we'll be offering meditation classes, and I really, really encourage you all to take a 4-week meditation class, because taking a structured meditation class is a way to kind of get you started on this path, and I really strongly encourage all of you to take advantage of that. The Restoring Balance class is the 4-week class that I take. It is more of the same of exactly all the things I've just told you, except that it's 6 hours instead of 20 minutes. So it's a really pretty fast run through. But the take-home message is that you need to take care of yourself first, because you'll be a better caregiver and you'll manage the stress of caregiving a whole lot better.
Thank you, Bethany.